Children's Hospital Colorado is seeing a surge of kids with respiratory viruses being admitted to the hospital.
Colorado is now one of 28 states where hospitals are reporting a significant increase of pediatric patients. KRDO News Channel 13's Jessica Grunling has more on what parents need to know.
Children's Hospital Colorado says they first started to see an increase in the number of kids with respiratory viruses in late summer, which is months before its usual peak in the winter. As kids headed back to school, Children's Hospital Colorado in the spring says they started seeing more patients come in with respiratory viruses like rhinovirus and enterovirus. That trend is shifting to more cases of RSV and the start of flu cases. RSV is a common virus that mostly causes mild symptoms similar to a cold, but for some children, RSV can be severe.
What we're seeing is an early increase in cases of RSV, leading to a lot more children presenting to emergency departments and requiring hospitalization for the infection.
Children's Colorado says if your child is showing signs of labored breathing or can't stay hydrated, you should take them to the doctor.
If they're noticing that there's sucking in the skin between their child's ribs or underneath the ribs, that's usually a sign that there's difficulty breathing. Obviously, if your child looks blue around their mouth or lips or their fingernails, that's a really serious sign and you should seek medical care right away.
Doctors note that this uptick of viruses follows the end of COVID-related restrictions, when many children were masking, social distancing, and not as exposed to these viruses.
During the pandemic, many people were not out socializing. Many people were masking. We do have a generation of children who have not seen many of these viruses.
To avoid a difficult winter, healthcare officials are stressing the need for families and their children to be up to date on their vaccines. Reporting in the newsroom, Jessica Grunling, KRDO News Channel 13.